Hey guys, welcome back to my channel. It's your girl Deborah Uwadia. I'm a registered nurse based here in Calgary, Alberta, Canada. If you're new to this channel and you haven't subscribed, what are you waiting for? Please go subscribe and give this video a thumbs up. In my last video, I talked about how to become a nurse in Canada, but it was more of an introduction. Today, I'm going to be talking about step-by-step guide or guidelines on how to become a nurse in Canada. So yeah, stay tuned and let's talk about this together. So guys, I have my paper here. This is an informative session. I'm here to inform you. I'm here with the information, every single thing. Let's talk about it. Let's talk about how people become nurses in this Canada. The first thing is the education. You have to have a high school degree to become a nurse in Canada. That is one of the steps. There are lots of steps, but this is one. You have to have a high school degree or equivalent. This is one of the requirements that most of the universities ask about. Next up, research nursing programs. Look at different programs in different provinces and find out the one that works best for you. You want to make sure that these programs are accredited, or the school that you want to go to is accredited. We all heard about what happened in Florida, where some nurses graduated, and after they put in the work and stayed in those schools for 2 years, 3 years, they found out that the schools were not accredited and their nursing degrees had to be relinquished. So we don't want to ever be in that position. So make sure that you're doing your research and you're finding out that these schools are accredited. So next up is choosing a nursing program based on your preferences. So in Canada, we have different types of nursing programs. We have the accelerated nursing program, also called the compressed nursing program. We have the 4-year bachelor's in nursing program, and we also have the licensed practical nursing program. So the compressed or accelerated nursing program is also a bachelor's in nursing program. It's just that in this program, summers are taken off, so you don't have any break at all till you're done. We have the 2 years program, and I know of schools that offer the 18-month program as well. Before you get into this, most of the schools require that you must have had a previous degree. Yes, you must have had a previous degree, and you must be able to show proof that you've had a previous degree. So they want to check, they want to see this through WES conversion, so World Educational Service. There's something called World Educational Service. If you schooled elsewhere aside Canada, that converts your degree from your country to Canadian standards. So they want to see that you have this converted, and they're going to compare this to how they do their GPA system here, and they see if you're going to be accepted or if you have the requirements to be accepted into this program. Now, for the bachelor's in nursing program, that's the 4-year program, people can come right from high school into this program, and that's why it's 4 years. It's very rigorous, not as much as the accelerated nursing or the compressed program, because compressed nursing program I feel is more rigorous because you have no breaks. You have to literally sleep, eat, breathe in your books till you're done. But the bachelor's of nursing program, at least you still have a little bit of break here and there. Then the last one is the licensed practical nursing. This is a 2-year program depending on the school, and for the licensed practical nursing, it differs from registered nursing, because as a licensed practical nurse, your scope of practice is different. You have less scope of practice as a nurse compared to the registered nurse. So the registered nurse has more scope of practice than the licensed practical nurse. So yes, look at all this and see what you want to do. Look at the schools that offer different programs and look at how long you yourself you want to stay in school. This will help you make an easy decision in your program. So another thing you have to consider aside the program length is the curriculum. Like you have to make sure that when you're researching, you're seeing that these schools offer not just the theory portions, but they have clinicals and they have simulations or something called practicum. Now I'm going to explain that for you. So you know how we are used to going to classes and, you know, receiving lectures from professors. That's not the only components in nursing school. There are 2 other components called the clinicals and the practicum. For the practicum, you get to go to a simulation lab. You practice with like doll babies, or you practice with you practice with other students, or you practice with your professors or your lecturers. You do a full physical assessment, you ask questions. If you're making a mistake during a full physical assessment on the dummy, your professor is just right by your side, so they're telling you, no, listen to S1 and S2 here. You are making sure you're checking the skin, you're making sure you're using the ADPI method. All this is just to make sure that when you get into the real world and you see real life patients, you're able to give the best care. So most schools do the practicum before they send you for clinicals. So in my year 1, I did a practicum before going into long-term care to offer real life care to real life patients. So this really helped me and built my confidence. So this is what I'm talking about. You have to go to schools that are there for you, that they know that things are bound to happen. They're not just throwing you into fire. They are making sure that they are training you behind closed doors before sending you out to the field to practice on real life patients. Because talking to real life patients and practicing with real life patients is not easy when you've not practiced. So this is what I'm talking about. This is what I'm saying, that you have to check the curriculum of the schools to make sure that, they are giving you standard ways in becoming a good nurse. So the third thing I'm going to talk about is the clinicals. The clinicals is when you're done with the practicum and you're going into the hospitals to provide care to real life patients. This is one of my favorites, and I want to implore you that you should check your school to make sure that they offer this. The school I went to, for every semester we had, for what we were learning, we had a practicum. If we're learning obstetrics, after that theory part and the practicum part, we're going to hospitals to make sure that we were practicing on real life patients. So yes, this is what you should think about. Check that these schools are not just collecting you and giving you the theory portion, but they are also giving you value for your money, and they are training you to becoming a good nurse. So when you are done with your program, or when you're about to be done with your program, there's something called the preceptorship. So what is the preceptorship? This is a time in your life as a nursing student when you're paired with someone called a preceptor. This person is your eyes, your nose, your guide. They want to make sure that you're safe to practice when you leave nursing school. I love preceptorship because it makes you independent. It makes you see yourself as a registered nurse or as a grad nurse. It makes you see your lapses. Okay, so how can I do better before I graduate? And it makes you happy because you're almost done with school. So you're like counting down and the weeks are close and you're like, hey, 2 weeks more, 1 week more, 3 days more, and you're almost done. So that's why that's what I love about the preceptorship program. So for my school, choosing the preceptorship area that you wanted to do was based on your GP. So let's say you want to do obstetrics and there are 2 slots or there are 2 student slots for the obstetrics preceptorship program, and there are 10 students applying for it. They'll check the students with the highest GP and give it to them. So that's how my school did it. I don't know how other schools do it, but I feel like this is great because then nobody gets to be cheated, and people would want to work hard to make sure that they are getting the preceptorship they want. And why preceptorship is so important is that it helps you add to your resume when you're done. So let's say you want to be a medical surgical nurse and you do like 3 months of preceptorship. When you apply and they see it on your resume, there's a high chance that you will get offered a grad nurse position or a registered nurse position because they see that you have some degree of experience in that field. So these are the advantages of having a preceptorship that you are passionate about. For me, I did my preceptorship in mother baby. I love mother baby. It's called the postpartum unit, where mothers are done giving birth and you have to care for both the mother and the baby. I loved it so much, and I had a very good preceptor who taught me rigorously. Emphasis on rigorously. Like, she taught me, and I'm very grateful about that. And up till now, it's still something I'm very passionate about. So yes, think about it. Think about what you want. In fact, from your second year or your third year, start thinking about where you want to do your preceptorship and work towards it. If your school is like mine, where they use the GP to be able to see who gets accepted into the preceptorship program, start reading, get your grades up, and the sky is your limit from there. So when you're done with school, like, what's the next step? Okay, I'm done now. What do I do? Do I just go on to become a nurse? No, it doesn't happen that way. I'm sorry. There's something called the NCLEX, but I'll talk about that next. But before that, let's talk about how you can apply to the regulatory body. Different provinces have different regulatory bodies. So there's the College of Nurses of Ontario, they have the College of Nurses of Alberta, they have different regulatory bodies depending on the province, and each regulatory body has different requirements. So you have to make sure that you know where you want to end up as a nurse. You can have 2 or more licenses, but that just means more fees for you, because every province has a different fee for nurses. So the higher the number of provinces you're applying to, the higher the fees you're going to be paying for licensing. So these regulatory bodies, for example, College and Association of Registered Nurses in Alberta, would give you guidelines on how to apply to become a nurse in their province. So let's say you didn't finish from Alberta, for example. Let's say you finished in Ontario and you're coming to Alberta as a nurse. Just right before you graduate, it's advisable to call them to see what requirements they might need. Like, what do you need from me? Do you need my school to send you my transcripts? Do you need them to tell you when I'm completing school? What do you need for me to be able to transfer my degree from where I schooled to where I want to be? So just ask them and they'll give you guidelines of how you could be a nurse in their province. Like I said before, each province is different and each province has different requirements. So you have to make sure that before you're done with school, you're finding out these requirements before you finally take the big move. So next is providing the required documents. This regulatory body would definitely ask you for some required documents, and this may include proof of degree, your transcripts, having your school send them a message personally. Believe me, yes, they do every single thing. So you have to make sure that you're ready. You have to make sure you're letting your school know, whoever is in charge in your school, you're letting them know that, you're applying to another province, or you're applying to the College of Nurses in Alberta or in Ontario, and that they should look out for any message from the college. So you have to make sure that you're getting everything ready as you graduate or as you're about to graduate. So I know you want to know, for international students, is this process the same? Yes. So if you get an admission to study in any nursing program in Canada, every single thing I've said generally applies to you. Once you're done, you can apply to the regulatory body and they'll let you know to get a job or find a hospital that can give you a job. Once you've gotten a job, you could apply to have a work visa, and then you could go from there. So like I said, each regulatory body has different requirements. So what the College of Nurses of Ontario is doing might be different from what the College of Nurses in Alberta is doing. So you have to make sure that you're calling them. They are very quite accessible. They answer their phones most of the time. So you just have to give them a call, explain your situation to them, let them know that you are an international student and you've just graduated and you want to know what the process is like. And they'll give you every single step-by-step guide on what to do. So the next thing you have to do after you've applied to your regulatory body is to start preparing for the NCLEX. The regulatory body will generally let you know how to apply to Pearson VUE and what things you have to do. Now this NCLEX RN or NCLEX PN, I'm going to do a whole different video about So stay tuned. It's not an easy exam. I'm going to share with you the resources I used that made me pass the exam, and what you should do while studying, and how many hours I put into studying every single day. So like I said, it's going to be a whole different video. So stay tuned and watch out for that video. So another thing I wanted to talk about is something called the graduate nurse program. So a graduate nurse or a new grad nurse is someone who is done with school and who is preparing for their NCLEX but hasn't taken the NCLEX yet. So this program was set aside for nurses who would want to work but also are preparing for their exams. The salary range is just $2 or $3 short from what registered nurses make. So if you really need to work while studying for your board exams, this program is for you. And I believe some hospitals, or lots of hospitals, know about this program and will give you a job as a graduate nurse while reading for your NCLEX exams. But they have to make sure that you're reading for the NCLEX exams. And some provinces, if you fail that exam once or twice, they might cancel that graduate nurse permit that they gave you, because they want to make sure that the job you're doing is not distracting you from reading for those exams. So make sure that you know what to do, how many months you want to spend as a graduate nurse before you go into writing your NCLEX, or before you go into being a registered nurse. So these are the things you should think about, and I hope this would help you make decisions along the way. So another exam you have to write once you're done with nursing school is something called the jurisprudence exam. This basically tests your knowledge on the laws of the province and the ethical standards required of you as a nurse. This is not a hard exam. You've gone through nursing school. Don't worry, you'll pass it. It's not something too difficult, but you have to prepare for it. You have to read for it, but it's not something that is hard for you to pass. They want you to pass, so they'll give you the right resources to help you pass this exam. So once you're done with the jurisprudence exam and you're done with your NCLEX RN exams, it might take up to 24 to 48 hours for your licensing body to get back to you, to send you that congratulatory message. Some provinces might take a few days, but just be rest assured that once you've passed this exam, it's the beginning of good news, because you can start practicing as a registered nurse. You can start practicing and you can be happy, and you can leave all your worries behind, all the worries of reading for NCLEX and just trying to make sure that you are passing that whole, and you are one of the people passing the NCLEX. Everything is done and you can breathe. My people will say, let the poor breathe. That's how I felt when I was doing the NCLEX RN exam. I was like, let the poor breathe, let Debbie breathe. Now, what did I do? And that exam, I'll do a different video. About the exam. Stay tuned. Maybe that will be my next video save. Let me just give you everything that happened to me in that exam, because I cried, I crowed. And yes, if you haven't subscribed, what are you waiting for? Go and subscribe so that you can see all my videos and you can share your worries or your testimonies in my comment section. Let's get to know each other. Let's ask me some questions. Are you an aspiring nurse? Are you already a nurse? How did it go for you? Was the process easy? And what advice do you have for other nurses coming into the profession? My own advice is, if you know that you're not going into nursing because you want to give care, then don't go into nursing. If you're just going into nursing for the money, it's a bad decision. So please think about it. Think about it very, very, very well before you go into nursing school. So I hope I've been able to answer all the questions you have about how to become a nurse in Canada. For now, stay tuned for my next video. Take care. Bye.